Well, a warm welcome to today's talk, Wednesday, the 7th of June. Now, first we had this World Health Organization new pandemic treaty, and then we had the World Health Organization international health regulations, which are going to be binding on member states and pass by default unless member states get up and actively prevent them from being implemented. Now you'll be pleased to hear there's something else. The World Health Organization Global Digital Health Certificate. And it must be pretty good because this lady's looking really delighted with what she is reading. Global Digital Health Certificate. More on what it means in this video. Now, this is in cooperation with the European Union. And now these ladies seem to be carrying things donated by the World Health Organization. So clearly the World Health Organization is a generous organization and is reaching these ladies in this picture. Now this is the European Commission and the WHO launched landmark digital health initiative to strengthen global health security. So hopefully you're all feeling more secure. Now, this is built on this original work here from the European Union Digital COVID Certification. So it's being rolled out now on a global scale to this lady's clear delight. So new pandemic regulations, new international health regulations, now a global digital health certificate network. You might have thought the World Health Organization had other things to do. I don't know, global health, for example, but it would appear they're on this organisational campaign at the moment. Now, let's look at it in a bit of detail because it is pretty important, really. And by the way, my apologies, unreserved apologies to those of you who were cut off mid-viewing on yesterday's video. Believe me, it wasn't what I wanted. I'm sorry that was that had to be done yesterday. Now, WHO Digital Health Certificate Network. So there's going to be an international network, digital. And there's a slight concern at the moment that I have. I've just become aware of the power of artificial intelligence. Combined with the global digital network, we won't go there at the moment. So WHO has established a global digital health certification network. Health certification network. Open source platform built on robust and transparent standards. So glad to see it's transparent. That establishes the first building block of a digital public health infrastructure. So we're going to have a global public health infrastructure. And it's all going to be mediated through the auspices of the World Health Organization. Now, here's their diagram here. So the country here will give their key to the trust anchor. Certificates, provenance, on boards, members. So presumably that means they know where the background is and they put people on board. Now, this trust anchor, interesting choice of word here, trust. Of course, this is the you've guessed it, the World Health Organization, who are controlling this. And then they're going to pass this on to relevant countries, again, all going through the trust anchor, who is the World Health Organization. And then they're going to allow different countries to distribute it amongst themselves for cross-checking. So it looks like there's going to be digital communication between the countries of the world, but all mediated through the good offices of the World Health Organization. That's what seems to be happening. Developing a wide range of digital products. So it looks like there's more to come, more digital products to come for strengthening pandemic preparedness. Background, member states using digital COVID-19 test and vaccine certification are ready. This is the European Union member states. As the directing and coordinating authority on international health work at the onset of the pandemic, this is the World Health Organization. So we're actually in a situation here where the World Health Organization is mouthing off being proud of, bragging about, that they're directing and coordinating of the international health response to the pandemic. I couldn't possibly comment, of course. You might think, and science might think, they didn't do as well as they could, but there we are. Now, WHO engages with all regions to define overall guidance for such certificates and publish digital documentation of COVID-19 certificates. So this was done. This is what the European Union did. It's now being rolled out to the whole world. There's a recognition of an existing gap, so things aren't where the WHO wants them to be. Maybe the WHO doesn't quite have the amount of oversight and trust anchoring it would like, because we need trust anchors, don't we? Who knows why? Continued need of a global mechanism that can support bilateral verification of the provenances of health documents. Okay, so they want cross-checking digitally. Now these acronyms: Global Digital Health Certification Network. That one. Digitalization of international certificates of vaccination or prophylaxis. So everything's going to be digitalized. So vaccinations are going to be digitalized. Prophylaxis, prevention, is going to be digitalized. Verification of prescriptions across borders is going to be international digitalization on a single platform. International patient summaries are going to be included. Verification and vaccination certificates within and across borders are going to be included. They're going to know quite a lot about you, really, aren't they? And the cross-border bit, of course, means that digitalisation could decide, potentially, who crosses borders, or even indeed who moves within a particular country. The point is, it's all going to be monitored centrally by the World Health Organization. You would have thought that they'd have other things to do, like, I don't know, World Health, something like that. Anyway, this is what they're doing at the moment. Right. Expanding such digital solutions will be essential to deliver better health. So this is essential, right? So expanded digital solutions is essential. Now, this is a direct quote from the WHO, so it must be right. So expanded digital solutions will be essential. This is essential for your health. A global digital solution is essential for your health. Sit there and be grateful. Say thank you. I keep forgetting what it is. The Global Digital Health Certification Network has been designed to be interoperable with other existing regional networks. So it should be useful all over the world, interoperable. Now, this is the EU bit here, this collaboration with the European Union, and this is detailed on this page here. So do check this out for yourself. The material here I've used is mostly direct quotes from the European Union WHO collaboration. Now, WHO and European Commission have agreed to partner in digital health and a digital network controlling vaccination, prophylaxis, cross-border, whatever was on the list. The partnership will work to technically develop the WHO system with a staged approach to cover additional use cases. So, in case you were getting concerned that it's only going to be covering these things we've mentioned, don't worry. It's going to be rolled out to other aspects of life as well. So nothing to worry about there at all. What could possibly go wrong? In June 2023, WHO will take up the European Union system of digital COVID-19 certification to establish a global system. So we're establishing a global digital system, but don't worry, it's all controlled by the World Health Organization. You could ask who controls the World Health Organization, but that's beyond the remit of this video. That will facilitate global mobility. So if you want to get around, there you go. It'll be facilitated by a certification to establish a global system. World coordination, world power centrally controlled. Dr. Tedros, the former politician in charge of the WHO. WHO aims to offer all member states on the principles of equity, excellence, innovation, transparency and data protection and privacy. So so nothing to worry about. I'm glad to see that's all been taken in hand by the good academic doctor himself. Good. So nothing to worry about. Commissioner for Health and Safety, this is European Commissioner. This partnership is an important step for the Digital Action Plan of the EU Global Health Strategy. We contribute to digital health standards and interoperability globally. So this is very much a global ambition. Commissioner for the Internal Market, again European Union again. The European Union certificate has also facilitated international travel and tourism. So it's good that they're facilitating international travel and tourism, helping people to travel where they want to go when they would like to. I'm pleased that WHO will build on cutting-edge technology to create a global tool against future pandemics. So the WHO is going to be using cutting-edge technology. Does that mean artificial intelligence? Don't know. Does it mean that? Don't say. But it's cutting edge anyway, so we're getting the very best that modern technology can throw at this problem. Create a global tool against future pandemics. So this global tool will be available. Can't we all sleep soundly now? One of the key elements in the European Union's work against the COVID-19 pandemic has been the global certificate. So yeah, the European Union has got these global COVID-19 certificates, and the WHO will facilitate this process globally. It's rolling it out to the world under its own structure. So it's going to be under the WHO structure. Okay. Allow the world to benefit from the convergence of digital certificates. So if you're in the world, good to know that you're going to benefit from this globalization, digitalization, certification process. Expanding such digital solutions will be essential to deliver better health for citizens across the globe. So this is essential. So expanded digital solutions is essential. I mean, heck, I might have thought that preventing preventable disease was essential. Treating malaria was essential. Improving people's diets, stopping smoking, increasing exercise, getting rid of air pollution, reducing water pollution, reducing economic oppression of the poor. I would have thought these things might improve global health, but it looks like the priority at the moment is this essential expanding digital solutions. So get this, expanding such digital solutions is essential. It is essential. This is not some sort of option. It is essential. We can't do without this. The WHO and the European Commission will work together to encourage maximum global uptake and participation. So if you're listening in, some faraway country in Fiji or Papua New Guinea or somewhere, don't worry. I think the WHO will get to you pretty soon. And this is essential. I do hope you're able to watch this video to the end. Let me know what you think in the comments. And let's all just be so grateful to this great organisation that is facilitating future world health. We'll leave it there for today. If you did have any concerns, do contact your own local politicians about this, because they still have the power to arrest this process for a short period of time. But what you often find is once power is established, especially with digital control, facilities that weren't available to previous generations, it's going to be hard to get it back again.